Well, getting older comes with its own sets of challenges, and for some women, that could include trying to stay looking as young as possible for as long as possible.
Yeah, well, this year there is a new trend where women are actively aging. Dr. Alexis Parcells is a board-certified plastic surgeon, and she joins us this afternoon with some different ways that women can embrace their age. Thanks for being with us today.
Thanks so much for having me. It's great to be back.
Yeah, so, we all say, like, embrace your age, enjoy it, this is where you're supposed to be, but it's not always easy to do that. You say active aging, though, is this year's beauty buzzword. What does that mean? Because I like the way it sounds.
Yeah, I think traditionally the language was anti-aging, and anti is negative, and we're all aging, so we should be embracing that process. And so by saying that we're actively aging, it allows us to engage in the process and be active and proactive about that process.
Some women are used to this like long 12-step beauty care routines. Is that still the case these days? Because I can get through like maybe 3 things and I'm done. I can't.
Yeah.
Maybe 2.
Yeah, that 12-step routine, it's a little antiquated.
Yeah.
We want products that are really going to work for us now. Multitasking products are huge. So you want your cleanser and toner in one. Products that have both an active ingredient such as a vitamin or a hyaluronic or a retinol mixed with a moisturizer, those are great. Having science-backed skincare is also very in vogue right now. There are a lot of professional physician-grade lines which have stronger products which will deliver a more clinically impactful result as opposed to some drugstore brands. And menopause skincare is really in vogue. Finally, being talked about. So many women 40s and 50s and beyond are seeing skin changes. And so it's nice to incorporate ceramides and hyaluronics and glycerin into your routine when you reach that point in your life.
Yeah, it sure is.
All right, let's talk about those LED masks, those chemical peels and other devices people can use at home. They're growing in popularity, as you see all on social media. Is there anything specific that you recommend?
So with any home device, it's not going to have that clinical strength as a device that you'll see in a medical or professional space. That being said, it can work as long as you are doing frequent treatments. And some people prefer them because they're not as expensive, not as much downtime, and that you can do it in the comfort of your home. So as long as you understand you're going to be committed to this, then you should see some results. But if you are looking for that professional, I'm ready for the downtime, that 3 to 5 days, I want that sort of professional power strength treatment to my face with a chemical peel or a laser, then you should be going into a physician's office or a medical spa.
Yeah, and I'm seeing a lot of those medical spas, pop up all over the place, and I'm seeing physicians on the other hand doing a lot of things that extra that they wouldn't have done maybe 10 years ago. So, what are some of those in-office treatments that could help out?
So Botox and fillers, those are tried and true. Those have been on the market at least 10 years. I think Botox is coming up on its 20th anniversary.
Yes,
we know that these products work. And there are more sophisticated products that are also coming out in terms of the injectable space, which will be exciting to see over the next few months and few years. Some are in clinical trials. But yeah, so those are great. And then as a plastic surgeon, I offer in-office tweakments, as I call them. So earlobe repairs as we get older, sometimes the lobe itself can get a little bit longer, and by doing a quick little 30-minute procedure with local anesthesia, it can allow your earlobe to look more youthful. Upper eyelid lifts, same sort of thing. 30-minute procedures where we just take a little bit of skin in the upper eye can just help open your eyes. So these sort of tweakments, really minimal downtime, really no discomfort long term, pretty quick turnaround, and pretty straightforward. So those are great.
Doctor, I know a lot of us can hide our ears, with hair and things like that, but I need something for my hands. I feel like my hands show my age. I don't know about anybody else.
The hands are always,
Yes. I always say it's face, neck, and hands. So whenever you're applying a skincare product, you want to make sure that if you're using your hands, don't waste it. Don't wash it off. Go your face and then your neck and then your hands lastly. And sure, there are laser procedures and injectables that can be therapeutic for the hands.
Good to know.
I was wondering about that.
Right.
I don't know. It feels like that's a real thin area to be shooting things in, but if it works. All right, Dr. Parcells, nice to see you. Thanks for joining us again this afternoon.
Thanks so much for having me. Good seeing you, ladies.
For more information on tweakments and other procedures, go to alexisparcellsmd.com or sunnyskin.com.
All right.